we're talking mostly, it seems to me, about 3D printing as a training tool, but you can also print organs. Jacques maybe will lead with you, and then Carl, and then the doctors. To what extent is this really about printing organs as opposed to just printing a training tool?
Yeah, so I think so training and patient-specific rehearsals are what I'm absolutely focused on. I think in the future it may be, I would estimate it's going to be at least 20 years before we're able to create a functional organ that you can directly transplant artificially. I think that technology is a ways off. It's not even working all the time in mice for complicated organs, so they've had some successes for simpler organs like bladders, for example. But I think it's still quite a ways away before we're going to see I build an artificial living organ from your stem cells and put it in your body. I think that's still quite a ways away. What are your thoughts?
What do you think?
So, we just had this conversation in the hallway. We just, prior to this get together, back with 2014, you said, right?
Yeah, 15.
Yeah, 15, they 3D printed a functional liver, but it was very small. I mean, scale is the next problem that we have to overcome. So 3D printing organs, I agree, it's going to happen, I think. I think there's a lot, especially when you start looking at the regulatory process, this is a ways off. But what's not a ways off is the orthopedic space. If you think that, we get CT scans, full body CT scans now. I mean, that's normal. And imagine if you have, or if you're in an auto accident, if you're, in the military, and part of you have a massive bone structure that's removed. We could take that CAT scan and 3D print a direct replacement. Especially with knees and patient specific.
So I did an article on a company called Materialize, which is out in Belgium. That's what, there certainly is a surgical training aspect to what Materialize does. But their best examples are, people who have been in car accidents and there's no off-the-shelf implant to fix their severely damaged craniofacial maxilla. So that's really all about custom printing an implant, not a training tool.
Yeah, absolutely. There's a large group. There's a lot of us that get together routinely here and talk about what can we do with 3D printing, and within Cleveland itself. We're not that far away from doing all this. So we're very, very close. And 3D printing it's additive manufacturing, right? So you really can't, manufacturing is not really quite the perfect spot for 3D printing because it's much cheaper to mold something if you need a large amount of it. But specific parts, patient-specific parts, is right up its alley. And these big companies are very interested in it because they've been talking to us. What can we do? What's our next step? So these big 3D printing companies are very interested in it.